Hi everyone, welcome to Monday Tsene with Wellifehub Incorporated. My name is Vuyani Mulea. I'm an industrial psychologist registered with the Health Professions Council of South Africa. I want to have a conversation with you today about a topic that is very sensitive, but at the same time very important. I'm going to do my best not to approach the conversation from an expert or lecture-based mode, but rather to just simplify the conversation by making reference to Google, going through some of the stats with you, and just trying to make sure that we understand this topic without creating stigma around it. And the conversation that I want to talk to you about is suicide. Yes, you might be aware that South Africa is one of the countries in the world that are struggling with the notion of suicide. Suicide, as you might be aware, refers to somebody passing away as a result of actions that they inflicted upon themselves. So in simple language, suicide refers to somebody passing away because of actions that they took that led to their death, but those actions would have been deliberate from their part. However, what is important about suicide is that you don't have to frame it as somebody committed suicide, because when you're saying somebody committed suicide, it has a negative connotation, as if the person was in charge of their actions and they were doing that from the point of view of trying to harm themselves or harm those that they leave behind. Rather, we should understand suicide as one of the final episodes in somebody's mental health condition that has deteriorated to the level where they are unable to cope with whatever circumstances that they are faced with. And as a result, they end up not seeing the need to continue with life. And if the context in which they find themselves permits, they might be prone to committing suicide as the labeling goes. But it is important for us to frame it correctly. Suicide is actually death as a result, most of the time, of mental health related issues. And what we want to do with this conversation is to make you aware that all of us as human beings are prone to suicidal thoughts. And the reason why we are prone to suicidal thoughts is because all of us at some point in our lives face circumstances and situations and challenges that make it almost unbearable for us to continue living. And we then entertain these thoughts of thinking that maybe life will be better off without me, maybe the people in my life will live better if I'm not there, or maybe my own pain and suffering will be reduced if I am no longer on this side of the world. So what I want to do in this conversation is to share general information that you can access also if you just go to your phone and just type suicide stats in South Africa. You will see what comes out immediately when you type suicide stats in South Africa. You will see that the South African Depression and Anxiety Group, what we refer to as SADC, reports that there are about 23 known cases of suicide in South Africa every day. In South Africa alone, every day there are at least 23 known cases of suicide, which means there are those cases of suicide that we might not know of, but the ones that we know of, at least as far as the stats from SADC are concerned, is 23 known cases on a daily basis. That means there is a lot of people that we know, or sometimes people in our immediate circles that succumb to the mental health conditions that led to them taking their own life. And what we want to do is to try and think about some of the reasons why people would consider committing suicide as the labeling goes. But like I said earlier, we don't want to use the language that says somebody committed suicide, because we're giving it a negative frame. We're making it look like they committed it with the intention of inflicting harm on those who are left behind. But more often than not, people who succumb to suicide are people who were in a situation where their capacity, mental resources, and physical resources were depleted, and they were in a situation where they didn't think there's another way out other than to end their life. And what are some of those issues that cause somebody to think that it is possible that life will be better if they are no longer alive. Typical relationship problems: if people are going through divorce, if people are going through breakups, if people are fighting with their loved ones and family members, and generally relationship problems in our society play a very huge role in people thinking that their lives are not worth it anymore. So relationships are amongst the main reasons that are reported to us as psychologists as to why people consider suicide as an alternative. Sometimes when people go through a breakup or a divorce, or when they are not getting along with their children or their parents or family members, they think that there's no need to continue living. So it's very important for us to remember that when we are in relationships with people, be it our loved ones or our romantic partners or our children, we need to take care of the fact that how we interact with them and how we allow things to unfold could be one of the causes why they would consider suicide. So relationship problems is a big one. Another one in South Africa and in most African countries is the issue of finance. Finance is a very, very, very serious problem because, as you are aware, we live in a capitalist society whereby everything that you want to do needs money. You want to go to the doctor, you need money. You want to go to school, you need money. You need food to eat, you need money. You want clothes, you need money. So money is such a big part of existing in a capitalist world that we live in. Therefore, when people don't have money, they struggle a lot, and money affects other facets of people's lives. And when people are struggling financially, they normally consider suicide as an alternative, because especially people who are in positions of responsibility. If I can make an example, the reason why most men tend to commit suicide more than females is because there is an expectation that if you are a man, you must be a provider and you must be a protector. And in our day and age, providing and protecting entails financial stability. So when most men are not financially stable, they consider suicide as a way out because they feel useless and they feel disrespected and they don't feel acknowledged, purely on the basis that at that point in time, they don't have the financial resources to do what society expects from them. It is important to emphasize at this point that this is not something that should be taken lightly. Financial circumstances do make people feel worthless, whether we think this is supposed to be the case or not. Therefore, what we need to do is to change the conversation and not make people to feel useless if they are not in a financially stable situation, especially male figures. And male figures will also benefit from engaging with professionals and psychologists to ensure that they don't experience a lot of self-doubt purely on the basis that they are not financially stable. So relationships, finances, and work-related challenges like not getting along with your employer or facing retrenchment or having circumstances at work that are making you feel like you are going to lose your job. Those are also some of the issues that can make people to contemplate suicide. So if somebody is suicidal in your circles, what should you do? The most important thing that you should do is you should create a safe space for them to talk about it. Let's demystify it and let's not make people feel bad for having suicidal thoughts. Allow them to talk about it. Make them feel that it is safe for them to talk to you about it. And when they talk to you about it, just reassure them that their thoughts and their feelings are valid and you are here to support them and there are other alternatives, and make sure that if they need help, you are the first person who avails yourself to help them whenever you can, and also point them to the right direction in terms of getting professional help. Groups such as SADC, South African Depression and Anxiety Group, you just go on Google, you can find them, you call them, they have a 24/7 suicide helpline. Even on Google, when you go to Google and you just type suicide helpline, you'll see the phone numbers. You can give them a call and they can help you. Just make sure that when you are in a space where somebody is suicidal or you yourself, you're suicidal, just delay the action by talking to somebody. And it doesn't necessarily have to be a psychologist. It can be your partner. It can be a trusted friend. It can be a parent. It can be a spiritual person like a pastor or Tsene or a Sangoma, anyone who will help you to see things from a different perspective, can really, really help you to deal with those overwhelming feelings of suicide whenever you're experiencing them. Remember, all of us at one point in time of our lives, we will think of ending our lives. It is a normal reoccurrence of life because life does get overwhelming and difficult. What is important is that in those moments, we remember that we must anchor ourselves by talking to somebody else and getting a different perspective so that we may realign and find the strength to find other alternative solutions other than ending our own lives. In the interest of time, I'm going to end it here, but remember to always seek professional advice, and it doesn't always have to be a psychologist. It can be your pastor, it can be a sangoma, it can be a trusted friend, anyone who will give you a different perspective in whatever issue you are facing. Thank you so much. See you in the next episode.